And as Deidre said, I'm Mary Lou Hernandez. I'm a social worker at Banner Alzheimer's Institute. I appreciate everybody coming to this class and listening, and we'll look forward to your questions after we're done. So during this class, we're going to talk about how dementia affects communication and the ability for the person to understand. We're going to talk about some strategies to improve communication and some skills and ideas to avoid communication difficulties that can lead to behavior issues and how we can reduce them. So starting off, many people wonder about the difference between dementia and Alzheimer's or different types of diagnoses they may have. So just as a definition, it's important to understand that dementia is a very broad term that describes the category of symptoms that can include language, memory, personality changes, behavioral changes, decreased judgment. So I always look at it in comparison to cancer. So when somebody says they have cancer, you have to know what type of cancer they have. Cancer of the brain is very different than cancer of the stomach. So Alzheimer's is the most common type of dementia, but there's also Lewy body dementia, frontotemporal dementia, and vascular dementia. Sometimes people have mixed dementia. So there are different types of dementia, but dementia is a category. Sorry, my phone in here just rang. I'm getting used to working from home. So what is dementia's impact? So when somebody has dementia or memory losses, it does affect their ability to communicate. So to understand what people are saying to them, and for them to clearly communicate what they're thinking, their thoughts, their wishes, their ideas. And for everybody, communication is important, right? In order to get around in the world, to say what's important to you, communication is so vital. And it continues to be very important for a person with dementia and for their family and their caregivers. So as dementia progresses through the course of the illness, we have to modify and make accommodations so that the person with dementia's needs are known, that they're more comfortable, and that it's easier for the caregivers to feel that they're doing well and meeting their needs. And I always say that learning new communication strategies is a learning process. So you're learning new skills, you have to practice it, you have to be comfortable with it, and as people move through their dementia, you have to adapt as they progress and move through various stages. So again, we talk a lot about stages of dementia and how it affects all the various functions that a person is having to manage or encounter. And so with communication, we can look at differences between the early, moderate, and advanced stage. So when somebody has very early memory loss, the communication changes that we see very early on can be word finding difficulties. They may just not be able to say the right word that they're thinking of. So you may see, hesitations in their conversations. They may substitute words. So as they're trying to think of a word, they may say something that's close to it but different. Or when they're saying, they're thinking they need to put on their shoes, I need to put on, those things on my feet. So they may describe the word. And in the early stage, there may be difficulties with comprehension. So reading may start to change. They may not understand everything they're reading. If the person was an avid reader, sometimes keeping up with a book or novels becomes more difficult for them. Even, you may see mail piling up because they're not really able to discern the importance of everything. They may have trouble with directions. Again, if there's too much information, it could be overwhelming and they just might not understand everything. Or even for tasks, when there's a lot of directions, it might be hard for them to keep everything straight. And definitely in the early stage, you may see repetition. Again, it's a very common thing. They may ask the same question, tell the same story, ask for the same information. And in the early stage, they may be talking less because they may be aware of some of these changes, so they might become quieter, a little more withdrawn. In the moderate stage, we see decreased conversation. I have a lot of families or spouses that'll say, my husband just doesn't talk to me anymore. We'll take a ride in the car and he's quiet when he used to be a chatterbox. There may be increasing repetition. So again, in the moderate stage, when there's not as much thoughts about what to say, the person may be saying the same thing repeatedly. I know that when I have visits with a patient in the moderate stage along with their family, many times I'll hear the same few stories like, this is what I did when I was working and it was so much fun. And they may say that repeatedly throughout the visit as we're having a conversation. And in the moderate stage, they may be less able to make their needs known because, again, they're having to think of the words, they're having to express. So it might be harder for them to say, I'm hungry, or I'm having pain, I need some medication, I'm feeling uncomfortable. So again, it may come in their brain, but by the time they think about saying it, their short-term memory is sort of taken that away. And in the moderate stage, comprehension is increasingly impaired. So again, understanding a lot of what you're saying to them could be difficult if it's not simple or short. And occasionally in the moderate stage, if somebody had a different language growing up, they may revert to that more so, even though they may be bilingual and know English really well. Sometimes that first language starts becoming a little more predominant. And then in the advanced stage, we see people speaking much less. They may have what we call word salad, where they say a bunch of words, but they don't connect or make sense. So they may be talking, but it's really hard for you to know what they're saying. And many times you're relying on gestures or nonverbal communication. You may have to show them what to do rather than tell them what to do. Or you may need to surmise what they're saying based on their expressions. So communication expresses thoughts, wishes, and feelings. So again, a very important part of our life. And with people that have a dementia, many times their behaviors are a big part of communication. So, and again, this varies between the stages. So in the early stage, people are having, again, short-term memory loss. So you may see a frustration with that. And when they're not able to remember something, or when they're not able to find a word, the behavior that you might see is frustration and maybe a little irritability. They may also become more withdrawn because many times in the early stage, when people are aware that they're having more difficulty with their memory or with their communication, they may withdraw. I've had people and family members say that, the person with memory loss doesn't want to visit with their friends anymore or engage in certain social activities because they're embarrassed or worried about how they're going to come across, or that somebody's going to know they have a memory issue. There may be a little more paranoia, suspiciousness going on. So again, when it's harder for them to understand certain things. I've had, again, families say that if there's a spouse talking on the phone to a child, then the person with memory loss is certain that they're talking about them. Or if the name is mentioned, they're, thinking that they're speaking negatively about them. So again, the world is getting a little bit smaller and things aren't always interpreted the same way. And then again, in the early stage, there can be repetition, because when the person doesn't remember something, they may ask the same question again, or they may have something that's important, and so they're going to tell that to everybody, and they may tell it several times because it's important, so they want to make sure you know, and they may forget that they already said that, or told that story, or asked that question. Then in the moderate stage, you may see more resistance to things. So again, if you're trying to help that person with bathing or dressing, they may say, I'm fine, I don't need help, even though maybe they haven't showered in a few days, because they may not remember that, and they may become more resistant. If you're asking, are you hungry? Do you want to eat? No, I'm fine. Do you need help with this? No, I'm okay. Whereas, they're not aware that they may need help with it, and you are. So you may see some resistance there. Impulsivity is also very common. So especially with communication, the filter is sort of gone. So people with memory loss, especially in the moderate stage, might just say what they're thinking. So they may just blurt things out that you've never heard. So maybe the grandmother that never used a nasty word all of a sudden says things that you would have never expected. Or, families will go out with a person and they have to be very cautious because they may comment on how somebody that they see is dressed, or how they look. Oh, look at the clothes on that person, or that person's awfully fat. And again, it's not that they're trying to be mean. It's just that what is in their thoughts come out because they don't have that ability to repress it. People in the moderate stage can have delusions or misperceptions. So not uncommon, at night, shadows might look like a person is looking into the window, or something they see on TV could stick in their mind and they think that it could really be happening. In the moderate stage, people can be very restless, and that's sort of exhibited by maybe pacing, or a lot of people do what we call rummaging. So they may move things around, and so they may rearrange all the silverware in the kitchen, or move pots and pans, or take things out of drawers, or just sort of rummaging, moving things around, because sometimes that's because they don't know what to do. And then in the moderate stage, they may have a difficult time describing their needs or their concerns because they may not be able to find the words. So you may see a sense of frustration when something's happening because they're not able to say what they need. And in the advanced stage, behavior really becomes the primary communication. That's where, you sort of look at the person and you can see if they're calm and peaceful or happy and they're resting, or if they may be looking uncomfortable. It could be that they're hungry. They may have some toileting issues. They may have some pain, but they may not be able to say that. So you may see that more in a more uncomfortable expression on their face. They may be grimacing. They may be moaning. And that's where, as caregivers, as you know them, you might have to figure out what their need might be. So, common communication challenges to avoid. So, arguing. We always say that no one's ever won an argument with a person with Alzheimer's disease. And even though many times people will try to disagree and argue, the person with memory loss is pretty firm in whatever they're thinking is what they're thinking. So we always say, it's best not to have a major argument with them because it's just going to cause frustration for both of you, more anxiety. Everybody's going to get upset. You want to avoid explaining and reasoning. As our very smart PhD nurse that I used to work with at Banner Alzheimer's would say, the person's reasoner is broken. So explaining why something can happen sometimes doesn't make sense. So for example, somebody's driving was stopped. Well, you can't drive because you have visual spatial changes in your brain and it's not safe and all of that. And people with memory loss, it's like, I'm a great driver. I've never had an accident. I do well. So really trying to explain and reason with them is sometimes very frustrating for caregivers because they're not understanding. So the more you explain, the more they're going to push back. You can't stay alone at home anymore because you have memory changes and you don't know how to manage. If something unexpected happens, you wouldn't know what to do. And they're like, I'm fine. I do things all the time. I can do everything. I'm fine alone. I have no problem. But again, they're not understanding that. You want to avoid correcting the person with memory loss. So perhaps they're telling a story and you're saying, no, that's not really what happened. Because that's just going to make them feel bad. In their mind, whatever they're telling you is what they thought happened. So the more that you correct them, the more difficult it is. They may say, I just had, steak for lunch, and maybe you didn't. So does it really matter if they had steak for lunch or not? If they thought they enjoyed it, that's really all that matters. You want to avoid saying, don't you remember? Because they probably don't remember. And again, if you're reminding them that they're not remembering, it's just another way that they might feel bad. So you can talk about a topic, but maybe not say, don't you remember? You could say, oh, we had a great time doing such and such, rather than saying, don't you remember when we had such a wonderful time, because maybe they've forgotten. If you just talk about it, then it's just very objective. You're not saying words that might make them feel bad. Unwanted reminders. Again, reminding them that you've told them something 3 times. You're going to be going out in the afternoon, and so they're asking, what time are we going? What time are we going this afternoon? When's our appointment? And if you're saying, oh, I've already told you 3 times, can't you remember? All it will do, again, is make them feel bad. The best solution is just to answer the question again, which I know as caregivers it can get tedious, but I think sometimes that helps you to feel calmer, that helps them to feel calmer. Giving too much information, again, can be confusing for them. So for example, after breakfast, you need a shower, and then we're going to go shopping, and then we're going to visit our friends. They may only remember after breakfast, you're going to have a shower. Then after the shower, then you can say, okay, now we're going to go shopping. Because a lot of information is not going to stay in their brain. And so the simpler, the better. And then pre-announcing upcoming events. You want to avoid doing it too far in advance. So if you're saying you have an appointment at the memory clinic in 2 weeks, or our son is coming to visit from California in 2 weeks, they're going to remember that something's happening, but the sense of time changes. So they may not the 2 weeks may not mean anything. It could be that, oh, that's happening. So, for example, if it's a son coming to visit, they're going to be very happy about that. So when is John coming? When is John coming? And you may get that repetition. So sometimes not saying it too far in advance can be helpful. You know, I always think about a patient that I had whose husband had left to go on a trip, and actually he had left her alone, and she was going to be picked up in the morning to go to church. Well, she was up at 1 a.m. because he reminded her the night before from a distance that she was going to get picked up. And so she was up at 1 a.m. and she was dressed and ready to go to church at 1 in the morning and was waiting and waiting and waiting until they came, was calling him saying, they're not here yet, they're not here yet. Because in her mind, it was happening, she was ready, and the next morning didn't make sense to her. And again, you want to speak to the person with respect, even though you may have to simplify or you have to adapt how you're communicating. They're an adult, they're, you know, somebody you care about. So you don't want to act like they're not understanding, that you don't want to be childlike with them. You want to be respectful. And so you can be respectful, but be simple. So some of the different principles for communication over here is sort of a busy slide. So I'll go over some of these topics. So again, when you're communicating with somebody, you want to make sure that they're included. You know, and many times when I have a patient in the clinic with a family member, I'm still trying to make eye contact with the patient and, you know, include them as best I can, even though the family may be giving more information. But you want to make them feel that they're important. And sometimes they're understanding more than they may say. It's important to have a positive tone to your voice. Body language is very important. And if you're trying to communicate something and it looks like they're not understanding, if you're getting more frustrated, maybe you need to take a breath, step back, because they may not even listen to what you're saying if your body language is showing that you're upset or you're overwhelmed or you're having a hard time getting out what you want to say so that they understand. And the last thing on here is maintaining a sense of humor. Sometimes just being able to laugh about something just sets a whole different tone. And there's, you know, some families use humor very easily. It's something they've always done, so they can revert to that. Some people it's not as easy for, but if you can twist something around and sort of laugh about it, it eases up the tension, makes everybody feel a little lighter. You want to make sure you have the person's attention when you're talking to them. Sometimes you may need to touch their arm or, you know, put yourself in front of them, because if you're yelling at them from across the room, they may not hear what you're saying. I've had couples that have done that, and that can sometimes cause more controversy or tension because the spouse is yelling to the person with memory loss, is saying, well, you're not hearing me, and they may not be paying attention. You want to minimize background noise or other things that are distracting, because a lot of things going on at once in the person's mind that has memory changes can be like clutter in the brain. So you want to turn off the TV, the radio, try to remove some of the background noise so that if you want to say something that's important, they have your full attention. Even when you're out in a group setting and you're visiting with people, it's sometimes helpful for the person with memory loss to have more one-on-one conversations, because if there's a group of maybe 3 or 4 couples, that's quite a few people. And if the person with memory loss is in the middle of that group, there may be several conversations going on, and they may have a hard time knowing which one to pay attention to. Or by the time they're thinking, oh, I'm going to respond to this, the conversation's moved on. So keeping them sort of at the end of the table with people that can talk to them one-on-one is going to make their involvement more successful. And again, I've sort of said this, you want to keep messages simple to the point. Keeping things short and simple is ideal. If you're giving instructions for something, you might need to do it one step at a time. Okay, let's, maybe they're going to help you in the kitchen. So you might say, here's the silverware, and then you take it out and give it to them. Can you put it on the table? Then they go and put it on the table. But if you say, well, can you take out the silverware and go put it on the table? Then they would have to go find it, and they would have to take it out, and they'd have to figure out which ones to take out. There's a lot of steps in that, and it can be a bit overwhelming. And then you want to really observe the person so that they are understanding what you're saying. So you're going to, watch their expression. Make sure you're seeing that they're understanding. If it looks like they look a bit confused with your conversation, maybe you step back and say it in a different way that's a little bit simpler. Sometimes even using gestures can be helpful. So maybe, for example, you want them to go to the bathroom. Well, let's try, it's time to go to the bathroom. Let's go over there. And they might look at you and not know. So maybe you go and you take them by the arm and you walk them over there. Sometimes doing rather than saying can be a good form of communication if they're not understanding you. And then finally, respond to the emotion first, because if they look upset about something, you want to be reassuring. It's okay, I'm here to help you. Don't worry about that. There's nothing to be concerned about. So responding to the emotion lets them know that you're there for them. So some of the communication strategies that are helpful is, first one, don't argue. And this is, we have this on actually one of our tip cards that you can find on our website under banneralz.org, or if you've been in the clinic and picked up some of our care tips, actually avoiding arguments is probably the one that I give out the most. And that's sort of, don't argue, you want to agree, apologize, defer, distract, and I always add on there, play dumb. So I thought I'd use an example of somebody that had their license taken away. Perhaps their driving wasn't very safe, and maybe the doctor sent in a letter to motor vehicles, and they got a letter and the license was revoked. And they're very upset about it. So agreeing would be saying, yes, I understand. It's so difficult not to have your license. I can understand that this is upsetting to you, because you're focusing on their emotions. You're agreeing that it's upsetting. You're not agreeing that they should drive, but you're agreeing that it's upsetting. So you're focusing on the emotion rather than the fact that they want to drive again. And then you apologize. So again, you're responding to the emotion. It doesn't mean that you did anything wrong or that the doctor did, but you're apologizing, saying, oh, I'm so sorry that you're not able to drive, because yes, I understand it is upsetting. I'm sorry that happened. I'm sorry it happened to you, because I'm sorry can be a calming word. Again, you're on their side. And then maybe they're saying, okay, well, this letter says I can take another driving test, so I want to do that. And maybe, you might try to defer that. So you can say, well, yes, but we have to call and make an appointment, and it's really hard for me to get through to them. So, it's something we can think about doing. So you don't, you're not going to get on the phone immediately and call and make that retesting appointment. Maybe you're going to try to put it off. So ideally, they might forget about it. And then maybe you can distract. Okay, let's go take a walk. Let's just change the atmosphere. I just made some brownies. I bet you'd like one. So you get their mind thinking somewhere else. And playing dumb, it could just be like, I'm just not sure why that happened. I think the doctor might have done that. Instead of being real specific, saying, well, you're not safe driving. You got lost. They're not going to remember that. So that's where you sort of play dumb. So avoiding arguments, again, a very easy thing to do, but sometimes it takes a while to learn. And I know in one of my support groups, one of my spouses' wives that comes, talks about this all the time, and it's something that it can take a while to do. It's something you learn and you practice. Strategy number 2, don't explain, reason, convince, coerce. So again, as I had said earlier, explaining, a lot of reasoning, it just isn't working as well in the person's brain. That executive function part of the brain is not working as well, and that's the planning, organizing, logic part of the brain. So you really have to think about accepting that the person's doing the best they can. They're really trying as hard, but their world is getting smaller. So the reasoner's gone, the logic is gone. If in their mind, for example, with driving, they think they're the best driver in the world and they can't understand why they can't drive, for you to explain that their brain doesn't perceive what their eyes see as well, and they may not be stopping, or they may be getting lost, they may not remember that. So the logic behind it is gone. It's important to simplify what you're saying. You want to keep messages simple, maybe a little more vague, not as much detail, because it can be overwhelming. You want to avoid yes/no questions. So, do you want tends to get a no. So I frequently am telling my families, do you want is something that you should take out of your vocabulary. Do you want lunch? No, but if you put lunch in front of the person, they're probably going to eat. So that's a good question to avoid. And then again, avoid saying, don't you remember, because the person doesn't remember. And one of our wise doctors would always say, the person with memory loss cannot remember what they forgot. And you want to be positively directive. So instead of asking, do you want to go for a walk? They may say no. That it can be helpful to say, let's go for a walk. I'd really love your company. I don't want to go alone. So maybe it becomes about you, and they're helping you, and they're being part of your world instead of you asking them the question. Making decisions is sometimes much more difficult for a person with memory loss. So being positively directive allows you to engage them in something without them having to decide. You also want to be cautious about rushing a person. People with memory loss take longer, and I hear this frequently. My person is sleeping later and then trying to get dressed and get ready. They used to be so quick, and now it takes them an hour and a half. Rushing isn't going to help. You want to look for the best time of day for appointments, so that if they're not a morning person, you're helping them get ready for an appointment in the afternoon when they're more awake, or maybe the afternoon's not good and the morning's better. But you want to observe, you want to ask. So, for example, if the person is having word finding difficulties, what is the best way that you can help them? Some people want you to fill in words, some people don't. And many times in my visits, I'll ask a couple, what works best? Oh, excuse me. I have to tell Banner that I don't have a fever, so I will be out of this in 1 minute. Okay, sorry about that. Banner has to make sure we don't have a fever, so everything gets interrupted so we can verify we don't and that we're not sick. Anyway, back to asking. So I'll have couples that will talk about what's the best strategy. If you're having word finding difficulties, do you want your spouse or your significant other to fill in the words? Some people do, some people don't. Sometimes they'll have a certain cue that'll help. Well, I'm going to look at you and then I'm going to need some help. So it's good to know what would work the best. But if it looks like they're struggling and you might be able to help, that's a good thing. Sometimes when couples are out for a type of event and the person with memory loss is worried they're not going to remember everybody, one thing that the partner can do is say, oh, hi, John, how are you doing? So that the name is already said. So there's different ways that you can help each other with that, but I think being on the same page is what's most important. You want to watch for confusion. So sometimes looking at the person, if they have a blank expression, if they're really not understanding you, if they're falling asleep, then they're not comprehending. I'll have people come in, especially in the moderate stage, where I'm having a conversation with the family, and the person, you can tell they're not even grasping what we're saying. Or sometimes, you'll then refer to them and ask a question, but whatever they're answering or responding to really had nothing to do with what you were talking about. So you want to be aware of when they're understanding, when they look confused. And then sometimes using gestures or pictures or, again, using, nonverbal, grabbing them by the arm can assist them when communication's difficult. So sometimes you're showing them something rather than asking them, like here, would you like a drink of water? And you give them the water rather than saying, would you like a drink of water, and not even showing it to them. So sometimes it's more visual to aid the verbal. We talk a lot about therapeutic fibbing, and a lot of people have difficulty with this. We also have another tip card on therapeutic fibbing that if you've been to the clinic, or you can get on our website under resources, many of our tip cards are on there. But it's not about purposely lying or being deceitful or disrespectful, but it's more about trying to minimize an uncomfortable situation or not giving too much information that can be difficult. So on the tip card it says, do you tell the truth when you know the information will cause them pain? Or anxiety, as I would say. Sometimes too much information is more than the person with memory loss can handle. And again, therapeutic fibbing takes practice, and many times spouses will be, I've never told a lie to my spouse, or an adult child, I can't lie to my mother. But you also have to look at what the outcome would be. If you're going to make them upset or anxious or nervous, is that a good thing, not always. So I think about a family that I had who moved their mother from California here, and she had a house in California, and wanted the house kept because she thought she was going to move back. Well, she had memory issues in addition to a number of physical conditions that needed attention from the family, and so they sold the house fairly promptly, but did not feel that they could tell her because it would have upset her. Why did you sell the house? You didn't tell me. I wanted to be involved. I wanted to help, go back and visit it, and none of that would have happened. So they just kept telling her, oh, the house is safe. The neighbors are checking on it. And probably about 3 years down the road, they finally told her it was sold. And by then she was so settled into living with them that was her new normal, and it was comfortable, and it was okay. But they felt that telling her at the time would have been difficult. So again, therapeutic fibbing, sometimes it's just being more vague or not giving people all the details. It can also be sort of just changing the facts a bit. So maybe the person, wants to go to the store every day, or it's late and they want to go to Home Depot, but you might say, well, we can't go today because my car's not working, or it's a holiday, it's closed, or it's too late. So we have people that think they can still go to work. So maybe it's like, I know you want to go to work, but it's the weekend. So instead of saying, well, you're not working anymore and all of that, because that might make them upset, it's better just to sort of go with the flow. And it can be a difficult thing. But again, I think sometimes as people learn to use the technique, they can find that it can be helpful and reduce anxiety, irritability, agitation. So moving on to discussing some behaviors. Many times behaviors have a trigger or a cause. So it's helpful if you're seeing a certain behavior, you might look back at it and say, why did this happen? What was happening around the time that this occurred? Did something change? Are they trying to tell me something? So many times when I'm talking with families, I'll say, well, try when things come up again, try to think of the trigger, what happened around it. And sometimes it helps for people to write situations down so that they can look back and review what happened. If you can figure out a certain trigger that made something occur, then how can you modify it or eliminate it so that it's no longer something that is more difficult for that person to manage? Some of the triggers that we see, one of them is change in routine. So what's really helpful for a person with memory changes is having a familiar, predictable routine. That doesn't necessarily mean that you have to do everything at the same time every day, but being in the home that they're comfortable in, and having breakfast at a certain time, and then maybe having a program or a walk at a certain time, or maybe they go to, when they're opened, an adult day health center a couple days a week. They get used to those things. But when there's a change in routine, it can cause some, confusion or discord. So perhaps all of a sudden there's visitors coming to the house. So the house that was very calm and quiet becomes noisy and disruptive, and they can't figure out why there's more people there. So things like that can be uncomfortable. Sometimes helping provide personal care as a person is moving towards a moderate stage and they might need some help with bathing or dressing. That can sometimes be a trigger for anxiety or agitation, because for a variety of reasons, a person can feel that their privacy is being invaded. They might be very private and would be uncomfortable with somebody in the bathroom with them or helping them. They might be uncomfortable with somebody helping them with dressing or picking out their clothes because they know what they want to wear. So again, a lot of times, gradually needing to help with personal care can be uncomfortable for the person. Not with everybody, but a lot of times, the person goes in the bathroom, shuts the door, and you don't know if they're bathing or if they're just turning on the water or what they're doing, or if they're getting confused with toiletries and all of that. And as you're trying to help, they may not understand why they can't do it themselves. Pain can also be a trigger. So again, somebody may have pain, but they might not be able to identify that that's what's really bothering them. Many times they might be uncomfortable, irritable, and you have to figure out they have pain. So if you know that maybe they have a back problem, you may want to think about giving them, pain medications on a regular basis so that they're comfortable. The environment can be a trigger. Too much stimulation or too little stimulation can cause problems. So again, if there's a family gathering and there's a lot of noise and commotion, that can be a lot for a person. I've had patients that have gone outside because it's too much noise. The kids can be, they may love the grandchildren, but all the noise and everything can be a lot for them. And sometimes too little stimulation isn't great, because that's when they may be sleeping all day, sitting on the sofa, not wanting to do anything. And then changes in environment can also be a trigger. So many times adult children will be caring for a parent that has memory loss, and maybe they go to another adult child's home on the weekend. But again, now they're moving out of that familiar routine, so it can cause them to be more confused or more upset, or they may be saying, I want to go back and see, the daughter or the son that they normally live with, because they're having to adapt to something new can take a while. So that change in environment can be difficult, even traveling. So you may try to take a trip with a person with memory loss, but and maybe they were excited about going, but once they're there, they want to go home in a day or two because the change in the environment is uncomfortable. They're out of their normal routine. And then sometimes unmet needs can cause a behavioral trigger. They might be hungry, thirsty, tired, having to go to the bathroom, and again, they may not be able to tell you that. So you might just see more frustration or irritability because they can't verbalize those needs. So some special topics that we'll discuss about behaviors and communication. So repetition is a very common thing when people have memory loss, whether they're in the early or the moderate stage and even the late stage. It becomes very common and sometimes very predominant. So why does a person repeat? Well, they don't remember asking something, or they don't remember telling the same story, and it may be important to them. They may ask the same question again because they've lost a sense of time. As I had said before, if you're telling the person, we have an appointment this afternoon at 2 o'clock and it's the morning, 2 o'clock may seem a long ways away. So they might just remember there's an appointment, and 2 o'clock, the sense of time changes. So what might be a short time for you could be a long time for them. or vice versa. So again, they may keep asking, when are we going to go? When are we going to go? And the question might not represent what the person really wants to know. So they may be saying, what day is it? What time is it? And you might be able to ask them, well, why do you keep asking that? And maybe they're thinking of something coming up. You're used to going to church every Sunday. So they're worried, well, I don't want to miss church this week. So you might ask them why they're asking, because they might be able to say something else that you can answer. And again, as I said, it usually has to do with when or something will happen because they're just not remembering that. So some of the strategies is to, again, avoid announcing anything more than 24 hours in advance. And sometimes even 24 hours is too much. Sometimes you tell them the morning of an event. And again, if they say, we have a doctor's appointment, why didn't you tell me? You can always use your agree, apologize, play dumb. Well, I'm so sorry. I guess I forgot to tell you sooner. And again, sort of inquiring what makes you ask this, and you can be assured that you're going to make sure that they get that whatever they're worried about happens, that you're going to make sure they go to church. You're going to make sure that that you're going to visit with a family when you have a plan. Sometimes writing the answer down on a little card can be helpful so that they can refer to that. So people have a whiteboard. Sometimes you put the day's events on the whiteboard, and you can say, well, go check the whiteboard. That's got the schedule for the day. I had a woman who would take her husband out to a restaurant, and he would order from the menu, and then he would forget what he ordered, and he'd say, what did I order? What did I order? So she would write down what he ordered and give him the card and say, okay, look at the card. You ordered the fried chicken. So sometimes that can be helpful. I had, and again, there's a lot of different strategies. People that are caregivers always come up with wonderful ideas. I had a woman who would tell her husband, well, we're gonna go out to the store in an hour, and he would keep saying, when are we leaving? When are we leaving? So she set a timer, like a kitchen timer, and said, well, when the timer goes off, we're gonna leave. So he could go and look at the timer clicking. Again, people that are caregivers always have wonderful strategies and ideas. Made up stories. It's actually called confabulation. And why does this happen? So many, and again, many times people will say, oh, they're lying about things. They're, things that didn't happen. They're telling me stories. So when people have memory loss, they don't always remember the details of things that happened currently, and even the long-term memory, things that happened in the past, all of a sudden may take a different twist. So the brain sort of fills in the blanks when it's thinking of something, and the person really thinks that the story's true. So our recommendation is don't try to correct them, or don't try to argue or to tell them that what really happened, because it's just going to cause more discord. So you sort of join their journey. If they're telling a story about something that didn't happen, you might just go along with it. If they're enjoying telling the story, let them do that. It's giving them some pleasure. If they're telling an upsetting story, then just try to get them off the topic, distract them, and then maybe let other people know that, they like to tell a story. Maybe it happened a little differently, but, and you might know it happened differently, but, if you just go along with it, it makes them happier. So you want to just let them speak. Let them say what they're saying. Does it really matter if they switched a story around? And again, I've had couples where it's taken a while for them to realize it really doesn't matter. Because I think the first inclination when you're hearing things is to correct them. Say, oh no, it really happened this way or that way. But in the long run, does it really make a difference? I want to go home. Very I've been hearing this a lot recently, so not an uncommon thing. And again, especially more predominant when a person is in the moderate stage. So this can be due to increased confusion, fatigue. The person may be sort of communicating that they're not sure where they're at. You know, people can wake up and all of a sudden not remember where they are, even if they're in their home. And it also indicates sort of long-term memories, secure feelings. So it may not, they may say, a person can be in their home, they may say, I want to go home, and you're like, well, you are home. But they may not really have a place in mind. Sometimes it's more of a feeling. So we always say to acknowledge the emotion. You know, I know you're worried, or you might be tired or concerned. Be reassuring, I'm here with you. You don't have to worry. You don't want to try to convince them that that's their home, because in their mind, if they're thinking I'm not home, the more you try to convince them, the more they're going to resist, because sometimes it can be a misperception. And again, we say you're not going to bring somebody that's having a misperception into reality, because in their mind, they're believing what they're believing. So, you know, you might say to them, well, we're just staying here for a while and I'm here with you, don't worry. Sometimes an adult child can call and distract them, or say, oh, well, you're staying over there for a little bit, not to worry. Some people will leave and go for a ride and then come back and say, oh, we're home. So there's different strategies to that, but if you can distract them and try to get them off the topic, the better. But trying to convince them that this is your home, you've lived here for 20 years, many times is only going to lead to more anxiety, more resistance. You're not my husband, you're not my wife. Again, definitely a very difficult behavior that occurs. And again, it can occur when the person's more fatigued or confused. It can occur because they're having memory changes and more confused about relationships as they progress. And they may remember their spouse as they looked many years ago, maybe not at the present time. So we always say, try not to take it personally, even though, the spouse that they don't remember, it can be very hurtful. But it's not that they're trying not to remember you. Their mind is just not working really well. So again, with any sort of a misperception, we say not to try to bring them to reality. So if you're trying to convince them who you are, I've had people say they'll get out the marriage certificate, or they'll show pictures and IDs, and that really might not work. I've had people do various things. Sometimes you leave the room and then you come back, oh, I'm John, here I am again. I've had some spouses put their name on their shirt, or they're John 1 and John 2. Using a sense of humor can really diffuse the situation sometimes. But, trying to distract them can be helpful. But it is a very difficult situation, and I think very offsetting for the spouse, because you're there. And so sometimes trying some of these different strategies can be helpful. Going to another room and calling the person, saying, oh, I'll be out soon. I think the most difficult situation that we had encountered was when a wife was going to New Zealand with her husband, and they were on the plane, and all of a sudden he thought that the person next to him wasn't his wife. And he's like, oh my, what did you do with my wife? Well, she got on the phone and started texting him saying, oh, well, your wife is at the, she'll be there when we land, everything will be okay. And I think it continued through their trip, and she ended up having to cut the trip short because he didn't recognize her. There was this nice woman with him, but it wasn't his wife, and it was very upsetting to her. And she was very creative, trying to use the phone and reassuring him, but it can be very difficult. And then announcing help. And this is a really big topic. I actually do a class on finding help at home and how you best manage this for the person with memory loss, and a class on residential care, how you think about when a person has to move. But when somebody has memory loss, and as their memory loss progresses, they eventually will need help. And it's really not just help for the person, but it's also respite for the caregiver, because as caregivers, you need assistance, because the person with memory loss is needing more and more care, and it can be exhausting for you. So, but a lot of times, a person with memory loss is not very receptive to getting help or having different services in place, because they think they're fine. So if you involve them in planning for it, they might be anxious, they might be resistant, they might be angry, and they may sabotage your plans. So if you're going to say get help in the home, you may not want to pre-announce it. You're not going to convince them that, oh, you're not safe to be alone when I go out, because they might say, I'm fine, there's nothing, I don't need a babysitter. So sometimes you introduce the other caregivers as somebody that's coming to help you. I need some help, I'm doing a lot of work, so I have somebody that's coming in to help me, and then as the person's more comfortable with them, then you can go out. I actually had another woman who had help at home because she said that the person that was coming over was sent by Banner Alzheimer's Institute, and the husband loved the clinic, so anything we did was fine. So that was very acceptable. And a residential setting, again, a lot of conversation about this, but usually involving the person in deciding about a move can be very anxiety provoking and overwhelming. So really it's something that you want to do without their involvement if you think down the road they may need to move, because they may not understand. And know that some facilities have respite care or day programs that the person could attend to get them comfortable with that. But again, this is really a big topic. So if you see in the future classes that we have on help at home or residential care, I discuss this a lot in a lot more detail at those classes. And then aggression. Many times people with memory loss have aggressive behaviors, and it really has to do with them feeling frustrated or angry, or just having more difficulty with some of the day-to-day activities. If they're verbally aggressive, it doesn't always mean they're going to become physically aggressive, but you want to try to not have the aggression continue. You want to try to minimize it, diffuse it as best you can. And if there is any physical violence, you want to make sure you're safe. You want to leave the room, have a phone by you. Sometimes adult children are great in diffusing any type of aggression. But you want to try to be on the same side as the person and give them the emotional support that they need. So again, the avoiding arguments, agree, apologize, play dumb, acknowledge that they're upset. It may help to minimize that. You want to be calm. You want to talk in a soft voice. You don't want to argue with them. If you need to, remove yourself. Sometimes if they're getting aggressive about something, maybe all of a sudden, oh, I need to use the restroom. Go in the bathroom, shut the door. I hear somebody at the door. I hear the telephone. I've got to go answer it. Sometimes removing yourself will will diffuse that situation. And if you can, if you can use pleasant forms of distraction. Again, food, candy, cookies, there can be a great distraction. Let's take a walk. Let's listen to some music. Oh, there's something on TV you really enjoy. And know that an aggressive episode is usually temporary, and the person with memory loss is going to forget the episode. The family member that it's happening with won't. So, but you have to remember that they will forget about it because they have short-term memory issues. So their memory loss can be positive in that respect. And then nonverbal communication is also very important. So 90% of communication is nonverbal. So the way you look might be very different than the words you're saying. And so again, when you're interacting with somebody, the way you interact with them non-verbally is important. It's important that you're in front of them so they can see you and they can look at what you're saying. Sometimes, again, touch can be very helpful. You're directing them, so you're giving them physical directions rather than verbal directions. You want to keep words short, simple. And, you want to, look at your facial expressions. Are you smiling? Are you frowning? Do you look angry? Do you look sad? Are you crying because something upsets you? They may react to that more than any of the words you're saying. And again, things that are very familiar can be comfortable for them. So the nonverbal, looking at pictures of the family, listening to favorite songs, saying, if they're spiritual, saying a prayer can be calming, enjoying treats, just saying really nice words, you're such a wonderful husband, you're such a wonderful father, and then sometimes reminiscing. So sometimes moving into those positive moments can be very reassuring. And then just to be aware that some behaviors are due to what we call delirium, which is a medical condition. So when there's an abrupt change in behavior, mental status, or function, it can be due to a medical condition. And so we usually suggest contacting the primary care doctor. For example, many women get urinary tract infections, and all of a sudden confusion may increase or irritability may increase. So it's important to contact the primary care doctor. If you think they're depressed, certainly speak with the doctor if they come to Van or Alzheimer's about that, or whatever other dementia specialists they're seeing, because it's very common that depression and memory loss go hand in hand because there's such a change. If they're having hallucinations, delusions, paranoia, again, it's good to talk about it. If you can handle it behaviorally, that's wonderful, but sometimes they may need a medication to take away some of that impact. If there's violence, again, you want to contact the doctor because there could be something that can be done to help minimize that. And if everything you've tried hasn't worked, you might contact the medical provider because they may have some other suggestions. Or Van or Alzheimer's, even, being able to contact the nurse practitioner or family and community services, because sometimes just being able to talk about it can give you other strategies. So in summary, there are significant changes in communication throughout dementia, and with that you have to learn new ways to communicate so that frustration and arguments are reduced. I always say that learning new things is a process, so give yourself time. Know that it's not going to happen overnight. It's a learning curve, and people are only human as caregivers, so there are times you're going to feel impatient or upset. So, forgive yourself, practice self-compassion, And then focus on your successes. So don't knock yourself down when something didn't work. Focus on what has worked well and give yourself credit. Share what you've learned with others, especially in the family. As they're interacting, you might be able to share what works best. And again, give yourself credit for learning new skills under very difficult circumstances. Sort of an ending, a quote from Rosalind Carter is, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver." Thank you very much. And I
Great. Thank you so much, Mary Lou, for the presentation. I want to invite our participants now. If you have any questions, I'll direct you to the lower left corner of your screen. There's a little chat feature that you can type your questions in, and we can share them with Mary Lou. We have about 15 minutes left with our time together today. But while all of you are thinking of questions, I have one for you, Mary Lou. I know we've done a lot of surveys with Banner Alzheimer's Institute, and we sent one out recently to caregivers to see kind of how is COVID impacting them. And a lot of people responded that one of the biggest challenges they're facing is changes in routine. And you had mentioned that change in routine can also be a trigger for these difficult behaviors that we're struggling with. Do you have any strategies that you could offer our listeners in how to kind of regain that routine, or how to manage this?
Well, I think, again, some of it is establishing perhaps a new routine, right? Because everybody's having to do that right now. So it depends what the person was doing. I know a lot of people were going to an adult day health center, a day club, that they're no longer able to do, or maybe going out for errands. One of the things that I've been sending to a lot of my families is the link for the Alzheimer's Foundation of America, because they have a lot of virtual programs that might substitute for some of the things that the person was doing. They have art classes online, they have music, they have exercise classes. So that might be something to think about. Maybe you, instead of going out shopping for errands, you're taking a walk together. I think it's just establishing some new routines.
Mm-hmm. Great, thank you. And it doesn't look like we have any questions in the chat feature. I do think, though, that folks' lines have been unmuted. So if anybody has a question they want to speak directly with Mary Lou, you're welcome to do that now.
Any questions?
Mary Lou?
Yes.
This is Beverly. Your presentation was excellent.
Thank you.
Thank you. Is there a way we can get a copy of that presentation?
Are you asking for the PowerPoint or the video recording?
The PowerPoint.
The PowerPoint?
Mm-hmm.
Yeah, I'd be glad to share that with you. If you, I'm trying to think of the best way for me to get your email. I'll be glad to send it to you.
So, Mary Lou, it's Deidre. If you want it, just let me know, and then I can actually email it to you after the class.
Is that Beverly? For Beverly?
For anyone who wants it, just let Deidre know, and I will email it to you.
Okay. It was just, it would be great to be able to look back at it to refresh.
Right.
Mm-hmm.
And Deidre, I'll send you that link, okay?
Thank you.
That's a great idea.
Yeah,
And in addition, with the video recording, it will take us a few days, but we will it will be converted to a YouTube video, and so then we can send the link out to everybody to access and reference again.
Sounds great.
Good. Okay.
Any other questions that we can pose to Mary Lou at this point? Well, Mary Lou, I want to thank you for your time this morning, and I want to thank all of our participants today, because I know we're tackling new technology and we have a learning curve that comes with that. So thank you to everybody who's been involved. We intend to continue to bring classes to you in this virtual manner on more of a regular basis. So we'll all be getting more and more comfortable with these platforms. Shortly after the class concludes today, you will receive an electronic survey through your email. Please do take a few moments to fill that out for us. We do take your comments very seriously and try to shape programs as you are sharing what your needs are and what your interests are. So thank you again for your time this morning, and enjoy the rest of your day.
So Heather, can we wait one more second? Someone's typing now.
Oh, sure.
Oh.
I think 2 people are typing.
So since we still have a few minutes left, Mary Lou, I do have another question that I can ask for you.
Okay.
I feel like, again, with COVID and with this change in routine, I'm getting a lot of feedback from families that their person is sleeping a lot more than they had in the past. And I know you had touched on how that can almost be a behavior, it can be a lack of stimulation. I'm curious your comments on how do we address someone who's sleeping a lot more than they had prior to social distancing? When do we know it's a problem, and what are strategies we can use?
Well, a lot of times sleeping is a sign of boredom. So I think varying up activities with that person, I think it depends what stage they're at. You know, if they're in the early stage, you might be able to engage them in some things. But again, it's not, do you want to do this? It's like, well, let's do a puzzle together. Let's play a game together. We used to love to play Scrabble. Let's play it. You're not going to play for competition, but you can play for the stimulation. If they're a little more progressed, maybe then you're having them, take a short walk with you, or go sit in the backyard and look at to go feed the birds, or to watch the pet outside. So I think it's a matter of engaging. You don't want to ask, do they want to do something? You want to, be positively directive and trying to get them to do some things. And again, know that they might need a rest period between something, or they might need to sit down and put their feet up, and that's okay. But I think it's a matter of being more creative and just thinking of some other things for them to do, because otherwise they may fall asleep, because their ability to plan and engage in activities is more difficult.
Mm-hmm. Great, thank you. And we had one of our commenters write in, thank you, excellent presentation and information. So I think, thank you again, Mary Lou, and thank you to all of our participants today.
You're welcome. Thank you.